Today is May 29th, Friday, and I'm here in Atlanta. It is 6 p.m. in Nairobi. It is 8:30 p.m. in Delhi, and we are welcoming you, Global Health Action, to our final in the COVID-19 Friday webinar series. Today we have with us Dr. Mupundo and Ms. Lebohang Mote. And we'll be discussing the global medical supply chain, AMR, and the implications for health systems in Africa. I'd like to welcome you all to our chat room as well. We'd like to share with you that throughout this discussion, and we hope that this truly is an engaging conversation, we will have opportunity for you to ask questions, pose comments throughout the session. And then just after the presentations, there will be an opportunity for us to have a response back and forth. And so I'll be moderating that session. So once again, welcome. My name is Janelle Williams. I serve as the Director of Programs here at Global Health Action. We're an organization that's been around for just about 48 years and looking constantly and consistently to change the world. Our goal is to really impact positively the health and well-being, especially of women, children, and adolescents around the world. And our heartbeat is really to ensure that communities are at the forefront or at the center of decisions as it comes to health and well-being. So again, welcome to our time today. This time will last for about an hour. Post the webinar, we will have the recording available and the presentations from our presenters. And without much further ado, I will introduce our first speaker today, and that is Dr. Murfin Mupundo, who is the head of REACT, Action on Antibiotic Resistance Africa. A little bit about Murfin. Dr. Mupundo is the head of REACT Africa, where he is responsible for strategic leadership in implementing REACT's strategic plan and activities in Africa, building partnerships with other stakeholders, including governments, supporting translation of evidence into policies, contributing to regional and global governance, and catalyzing action to address AMR. He is also the partnerships and stakeholder engagement lead for the International Center for Antimicrobial Resistance Solutions, responsible for Africa. He is a public health specialist with over 20 years extensive experience in global health policy, health system strengthening for pharmaceuticals and health technologies, pharmaceutical supply chain management, pooled procurement, global health security, conceptualizing and developing innovative, sustainable health financing options for healthcare delivery, and strategic development, regulatory policy, health policy, and diplomacy and network development. Dr. Mupundo has successfully supported several countries with AMR National Action Plan development and implementation, regional pharmaceutical commodity pooled procurement initiatives in West and Eastern Africa, and provided technical support to the WHO, FAO, OIE, Africa CDC, and the Southern Africa Development Community on AMR strategies and policies. Dr. Mupundo sits on several boards and technical working groups that includes the Surveillance and Epidemiology of Drug-Resistant Infections Consortium, WHO Strategic and Technical Advisory Group on AMR, and International Society to Improve the Use of Medicines. Thank you again and welcome, Dr. Mupundo.
Thank you so much. I really appreciate and I'm honored to be part of this webinar and panel. And I'll share some reflections on the topic that was given to me, looking at the global supply chain and for medical commodities, and also trying to link that with antimicrobial resistance as another global challenge that we are facing. So thank you so much, Janelle and team. I'm very grateful actually for this opportunity. Next slide, please. So what I'll try and do is give briefly the global and regional picture for COVID-19. And this is basically setting the scene for our discussion. I hope that this introduction and the reflections I'll share are going to to add value and enrich our discussions. Next slide. Next slide, please. Oh, thank you so much. Yeah. So if one looks at the COVID picture, the global picture, John Hopkins has got an excellent dashboard where they track and they show the numbers of both kind of confirmed actually cases and those that have unfortunately died or passed on. So we can see that as of this morning, we are just under 6 million in terms of those that are actually positive. And the deaths are around, 360,860. Next slide. Then when we look at the Africa picture, before we do that, we can look at this slide and see that this slide is giving us the COVID cases per 100,000 population. And the major point I think for me to make here is that we can see that there's no country in Africa that necessarily has escaped the impact of COVID. And we are seeing that in some countries, the cumulative actually numbers are higher than others, but are not as high as we have been able to see in Europe and also in the United States. And one of the reasons is that we haven't had a lot of testing in African countries. And so the true picture of what COVID is in the region is not clearly known. We have seen in the last actually 2-3 weeks that when we have enhanced the testing, we have seen actually more people testing actually positive to it. Next slide. So what we see the CDC, again, a slide from this morning. This is based on the update that they did on the 27th. We see that actually the cases have been going up, 124,000 around that number, and the larger number of cases in terms of actually the spread, it's in the northern part of Africa. The number of deaths is also actually going up, really, if one sees where we were last week or the week actually before. Next slide. So there are some characteristics or some context that is important to understand actually the implication of COVID and the supply chain, but also linking it with AMR. And I mean, one can say, I mean, very clearly that we know that, I mean, Africa has the highest burden of infectious diseases and non-communicable diseases. And this actually double burden is actually taking a toll really on the region. It's also home of actually more than half really of the global poor reside in sub-Saharan Africa. And again, we have got weak health systems that are challenged to address both the pandemic, but also to be able to continue providing the routine care. And some of these health facilities are actually in the rural settings, and they depend on a very small budget, and they can only be able to actually procure products for a short time. And there is also the high dependence in African countries on importation, because most medical products and most of the medicines that we need for our patients are not actually produced on the continent. And so we are dependent really essentially on the pharmaceutical companies of the world that are based in India, in China, and also in Malaysia. There is also the issue of constraints on the government capacity to be able to deliver services. We're talking about, I mean, services that include provision of water and safe water for drinking and for use. We're looking at health facilities that are actually stocked with medicines and the other medical supplies. We're looking at actually the human resource capacities. We're looking at actually medical schools and nursing schools. Some of the governments are actually constrained to be able to provide this. And unfortunately, most countries in Africa spend more than they can realize in terms of their income. And the fiscal constraints and the high debt is actually pretty high. For the first time in 25 years, we are poised to actually see a recession in terms of loss of actually output. And it is projected, the World Bank projects that we shall lose between 37 to actually 79 billion dollars in output just in 2020. And this has actually dire implications on provision of services like healthcare. The McKinsey company is actually putting it that, I mean, the loss is going to be between $90 billion to $200 billion just in 2020. And again, it's important to note that, I mean, Africa is a home of the most, I mean, fragile nation, conflicts and violence countries. And this plays a part in terms of, I mean, the provision of services and also the stability of some of these countries. The other thing to mention in the background is that the COVID-19 has actually placed really a shock on food chain supplies, for example, with the fact that there's been restricted movements and lockdowns. Products have not been able to move, I mean, from actually certain parts of the country to where they're actually needed. And again, this is the region that has the lowest universal health coverage actually index than any region in the world. Next slide. On this slide, what I wanted to show is that, you know, so really for the projection, we've seen that there's a projection of a decline in agricultural production by 2.6% to 7%. And with a new focus around, I mean, global poverty, is that there will be 49 million people who will be moved into poverty in 2020. And this is, I mean, looking at the definition for those people that live on $1.90 a day. And if you look at actually this graph, I mean, you see that, I mean, in Africa, there will be 23 million people roughly that are going to be pushed into poverty. And this is very important. Next slide. Next slide. So when we're looking at actually supply chain, really on COVID-19, is that COVID-19 has placed enormous stress on the global and country supply chains in terms of movement of raw materials, in terms of production, in terms of having finished products. The issues around logistics and moving these products to where they are needed. That is contributing to lack of access to medicines and other medical commodities. There are challenges that have been experienced in the dynamics of supply and demand through weak regulatory processes where some countries have stopped exporting some of the commodities because they want to keep them and they want to use them for their own people. And this is destabilizing the region in terms of availability of medicines and medical commodity. While the picture is a global one, the previous and weaker systems, like I mentioned in Africa, are going to actually face the large and bear the larger brunt, especially now that positive actually cases seem to be on the increase. Next slide. The 6 strikes of logistics, I think we are familiar with them, and we really want to have the right goods in right quantities, and we want to have them in right conditions so that they are delivered to the right place at the right time, and also that they are actually affordable. Next slide. So in times of actually emergencies, the World Health Organizations and other organizations have come up with some tools that can support the moving of supply or strengthen the supply chain systems in an emergency. And just real quickly to say that, these borders around, operational support that is very critical, ensuring that there is the support in the office, the people that are generating the orders, the people that are quantifying the orders, the fleet management, and the daily cash management, but also looking at the supply itself in terms of ensuring that the forecasting is actually quite correct, the warehousing is working, goods are transported and distributed. And then the other health logistics that I won't go into, but the major point is to say that, really the health programs really cannot succeed unless the supply chain delivers a reliable, continuous supply of health commodities to the customers. And so without the product, there is no program. Next slide. And on this slide, the main points that I wanted to list out again is that when we're looking at actually supply chain, we're looking at a number of complex factors and complex activities that work together in unison to ensure that actually products are delivered to places and to patients who need them. And so we've got the manufacturers that they play their roles, the distributors play their role, the providers do that, and the patients are the recipients. And each one of these actually steps has been impacted by COVID. Manufacturing, that has actually gone down, because a number of factories were actually closed down. And so that has been an issue. In terms of transportation, I mentioned again, there have been challenges in that area, but also just in the whole provision really of healthcare. And so we see that when we're looking at the supply chain is that, each of these important elements has got some key vulnerabilities. And I know that the slides are going to be available, so you can look at this in a bit of some detail. Next slide. But simply to put it, I like the way that the USAID has actually put it, and this is actually very real, especially for African countries, is that most of the products, as I indicated earlier on, are actually imported into the country, into the coastal, some come by sea into the coastal countries, and the landlocked actually countries, they depend on transportation into their countries to bring in the products. And these products would get into the warehouse, that can be in the region or the central warehouse, and these are delivered to the various actually health ports or health institutions in the country. Next slide. Next slide. And so we'll now look at the impact. So in terms of the impact, I wanted just to mention some thoughts around supply and demand. There's been a very unpredictable demand, and that also has increased the demand from health facilities. That has further complicated by unanticipated demand of the protective the personal protective equipment, because what we have seen is that there's been a run by the health facilities, by the government, but also by actually individuals. And so gloves cannot be found in most of the countries in terms of actually the shops and the warehouses. The masks, the gowns, and the face shields, these are not being available. They also, when one looks at manufacturing of medicines, there's what we call actually the active the pharmaceutical ingredients. That's the API, and unfortunately, the APIs currently are only manufactured in very few countries in the world, namely in China, in India, and in Malaysia. And with the lockdown that happened in China, a number of these manufacturing industries were closed, but also really in India, the pharmaceutical factory of the world. And so in terms of production of actually medicines, antibiotics, antivirals, and other medicines, there's been a stress on that. There's been the panic buying that also has happened. Really countries and also again individual facilities rushing to buy actually these products. Again, something that is very important to take note of is that some programs have been disturbed, and mainly actually immunization programs. They are not actually carrying out the immunizations as they do, which is not a good thing, because we need to actually address the problem that we have now, but also we need to be prepared to actually address the problems of tomorrow. So if people don't get the immunizations now, then I mean they will be prone to getting infectious diseases that are preventable. In terms of logistics and transport, again, the lockdown has not helped, and also the fact that that most of the airports in the region really have been closed in terms of actually transit, and so these are some issues that countries have to grapple with. But also in times of pandemics, the regulatory actually structures and frameworks in a country are very important, because we have to fast track some registration of some products that are needed, but really, but also at the same time to ensure that we are not allowing the falsified and the products that actually do not meet the quality standards that they should meet. Next slide. So really there's been a tipping of the balance. It's no longer a buyer's market, it is a seller's market. And so what that has done is that there've been some changes in terms of manufacturers and the wholesalers in terms of the conditions that they place. Most of these now are placing that you have to pay 50% now when you make the order, and then when they deliver, you actually pay the other actually the 50% that is remaining. But also there've been some delays in deliveries, but also those that have got more money and paying a higher price, they are pushed in front of the lines, and so countries are competing, and this is something that is not very good in terms of healthcare. There have also been excessive markups really by distributors, and also there's the questions that are really all the pandemics from 1918 going to the H1N1 is that we see a lot of proliferation of poor quality and standard medicines that come on the market, and this particular pandemic that we have is no different. Next slide. Global Fund, for example, they've projected that there will be delays in terms of antivirals, antimalarials, and TB products to get into the countries between 1 to 2 months delay, and that could be longer. And even when one looks at the mosquito nets, they expect actually delays in that, including diagnostics. Next slide. And really global initiatives, very briefly, is that we have seen, I mean, the global community actually coming together, and I mean, to pull resources together, put funds together to actually support the countries that need support. And LIMC countries, including Africa, are one of them. We've seen Africa CDC actually procuring and distributing testing kits in the region. We have seen, I mean, the World Bank, Africa Development Bank, the European Union, being able to extend grants to countries and emergency funds to allow African countries to respond, but also the public-private partnerships. This is something that we are seeing in the region, and it's quite encouraging to do that. Next slide. This slide just to show that the UN and WHO have worked out a task force that has basically is working to ensure that, I mean, countries get the supplies that they need. And so they've set up some hubs, one in China, one in Europe, in the Middle East, and also in the USA. And they've got, I mean, some regional staging hubs where products are going to, and these products are distributed really into the other regions of Africa. But we've also been able to see some things that have been good in terms that there are some of the tests that are being developed in the region. We've seen some of logistics in terms of actually supply where, you know, transportation, for example, Rwanda and Uganda have been testing the drones as one way to supply that. But we've also seen indigenous test kits that are being developed, including ventilators. And also we have seen a lot of investment globally with over 80 companies that are working on developing vaccines. And we hope to see actually more of this as we respond to COVID-19. Next slide. Next slide. Then when one is looking at the connection really of AMR and COVID-19, one needs to understand really that COVID is a viral infection. It is actually it's actually triggered really by a virus, and but in the process is that the patients that get admitted and end up into the ICU, they get secondary infections, and they also got super infections. And we know that the major drivers of antimicrobial resistance are actually the human antimicrobial misuse and overuse, but also the overuse that happens really in the animal sector. But suboptimal dosing is also one of the major. So what we are seeing now is that really when patients are admitted and they get the secondary infections, really the antibiotic use actually goes up. And when we start actually using more antibiotics, we create more opportunities for the pathogens or the organisms to develop resistance. And that's where we are seeing some of these linkages. Next slide. And again, as I mentioned, really, the drop in immunization rates is really making more children to get sick, and more elderly people also to get sick, because they are not being protected by the immunizations that they would have actually received. And so we will see challenge if we don't control. And so what we really have is that we've got an active pandemic, but under the pandemic of COVID-19, there is the lacking pandemic of antimicrobial resistance that is actually lurking behind. Next slide. So I think it's important to actually understand this, that you know, the more people cannot get the routine care that they need, the more people are getting sick and not being managed, the more people that get sicker, they actually end up getting some of the secondary the secondary infections I mentioned, and then again the use of antibiotics to actually prevent in terms of actual prophylaxis. And the one study that I've quoted here showed that there was actually in the patients that were admitted, 5 to 27% of the adults with COVID-19 in severe hospitals, they had the secondary infections, and 13% up to 44% of those patients in the ICU received antibiotics. Next slide. In terms of the way forward, as my last slides, I think we need to ensure that there is the investment both in the public sector but in the private sector. The faith-based organization, for example, they are one larger player in terms of provision of healthcare in Africa. Between 40 to 60%, they carry that load, and so governments need to ensure that in addressing COVID-19, in strengthening the supply chain systems, in addressing antimicrobial resistance, that they work along with actually other partners that are critical. There has to be really an adaptation of some virtual ways really of transaction. For example, seeing patients using a really the telemedicine, because we are losing out the routine care of patients, especially those with NCDs. Food procurement will improve in terms of getting the products in the countries, but also using the resources that we have in a most efficient, I would say, where capacity building very critical, strengthening our systems really of actually following up on the products that are coming in to ensure that they meet the quality standards that they should meet. Next slide. And really ensuring that really antimicrobial stewardship is taking place, revamping immunizations, routine care, harmonization of tools to ensure that we are gathering the data in a timely fashion and passing it on to policymakers, but also ensuring that while we address the immediate challenge of COVID-19, we don't forget that we have really another strong pandemic, and that is that of antimicrobial resistance. We know that, for a fact that we have around 700,000 people die every year from because of AMR. And we know that, by 2050, if we don't act now and actually put in structures that are strong, to actually strengthen these health systems, is that there will be 50 million people that will be dying every year by 2050. And we have to address, to actually address both pandemics. It is key that we do that. Thank you so much. I look forward to the discussion with you.
Thank you so much, Dr. Mapundo. This was such an incredibly comprehensive and sobering presentation. 50 million people a year dying because of maybe potentially the lack of mitigation as we're looking at COVID-19. I love the fact that you brought addressing the problems of tomorrow now. There's been a lot of conversation around shadow epidemics or shadow pandemics potentially, and you raising the issue of AMR. We've heard conversations around child health and the immunizations and the impact of the decreased immunizations. It's no longer a buyer's market. The competition amongst nations, not just organizations or sectors, but really nations competing against and for products. The shifts in supply chain, supply and demand, the delays in antivirals, antimalarials, and the like. These are really, really sobering challenges. But I think, what you shared with us today in terms of some of the activities and some of the ways forward that we can look at is what can we do today in our world and in our circle of influence. And so we've got folks here on the call who connect with governments and our governments. We've got folks on the call that are funders. We have folks on the call who are community members, who are faith-based. And so I think, fundamentally what I'm hearing here is the idea of how can folks really connect and collaborate together to begin thinking strategically of how we can move forward. And so I think these points really, really share with us what there are in terms of some options. We have some comments in the group. What I'm going to actually do right now is shift to the presentation by Lebohang Motai. But first of all, and I want to say thank you so much, Dr. Mapundo, for sharing this really enlightening work and presentation. And I look forward to us beginning to discuss a little bit more in the few minutes that we do have left in the time together.